Hello, welcome to Chiro Thoughts, where we talk about all things chiropractic and health. I am Dr. Adriell, and this week we are discussing GI function. I am going to get us started off here in part one, just getting into the different types of GI issues and the prevalence of them here in the United States. So I'm sure that you have heard the gut referred to as the second brain. So what does this mean? The second brain is also called the enteric nervous system. This is a branch of the peripheral autonomic nervous system. And when you think of autonomic, think automatic functions in your body, things that you don't have to think about to allow them to get done. This is the largest and most complex unit of the peripheral nervous system, with 100+ million nerves releasing neurotransmitters to facilitate that motor, sensory, absorptive, and secretory functions of the GI system. It is said that there are actually more neurons that reside in the human gut than the entire spinal cord. So the enteric nervous system is two thin layers of these millions of nerve cells, which line your GI tract all the way from your esophagus when you swallow that food, all the way to the rectum where you excrete those toxins, which communicates directly to your brain. So considering GI issues, it's absolutely no surprise that researchers are finding evidence that irritation in that gastrointestinal system and that lining may send signals to the central nervous system, which is your brain and spinal cord, which trigger mood changes. And unfortunately, there is a significant worldwide prevalence of these gastrointestinal disorders, including IBS, GERD, chronic constipation, and we're going to dig into those a little bit more in depth. So we are going to start off with IBS. So IBS is irritable bowel syndrome. IBS is also referred to as gastroenteritis, and it is the most common functional bowel disorder that is affecting between 5 and 25% of the population in the US at any given time. IBS can involve a plethora of different symptoms, including diarrhea, constipation, cramps, bloating, abdominal pain. Everything falls under that umbrella because it is a very broad disorder. IBS was actually recently reclassified as DGBI, which is a disorder of the gut-brain interaction that's caused by that miscommunication that leads to visceral hypersensitivity, changes in motility, hypervigilance, and when people eat foods that irritate that lining, or FODMAP foods, for example, which ferment in that gut, this creates gas, putting pressure on those nerves, and it alerts the brain that something is wrong. So the same thing happens when you are stressed out. The opposite is actually true. Instead of that GI affecting anxiety and depression, stress can actually trigger those same overly sensitive nerves, and they can create those same symptoms. So diarrhea, constipation, bloating, cramps, things like that, you name it. So the exact cause of IBS is unknown. There's a variety of factors. This is multifaceted. According to Mayo Clinic, it may be associated with SIBO, for example, small intestinal bacterial overgrowth. Other sources say it might be a food intolerance, but it always comes back to the hypersensitivity of those nerve endings in the intestines, and whether those nerves are the ones innervating the muscle to create spasms, or the food that you're consuming is creating gas, putting pressure on those nerves, or you're taking antibiotics, irritating the gut lining. You have bacterial overgrowth, you're enduring a lot of stress. There is nerve involvement sending signals to that brain. So that is IBS. The next prevalent GI issue that we wanted to address was GERD. We see a lot of GERD in our patients that present. They mention it a little bit later after they come in with low back pain or something like that. But gastroesophageal reflux disease is the most common, often chronic condition in which gastric contents come back up into the esophagus from the stomach. which is causing heartburn, and it can manifest as a few different other things as well. So there's a sphincter at the bottom of your esophagus called the lower esophageal sphincter, which keeps food and drinks in the stomach to be broken down with the use of acids and enzymes in the stomach, which help your body to digest them better and assimilate them, absorb the nutrients in the small intestine. So if the sphincter is not working, those digestive juices from the stomach find their way back up into the esophagus. So the esophagus was not made to handle this, specifically that type of acidity due to the type of tissue that is lined in your esophagus, which is why it feels like there is most often burning or just that uncomfortable like heartburn feeling in your chest or in your throat. Prevalence of GERD has been increasing worldwide due to a variety of different factors. Some of them such as rising obesity rates and unfortunately the widespread use of medications affecting the lower sphincter. So about 10% of individuals in the US experience heartburn daily, where 25 to 40% experience symptomatic GERD or acute GERD at some point during their lifetime. And the condition is likely underreported since many of those people who are affected try to control their symptoms with medications, over the counter typically, and just kind of curb those heartburn symptoms. Although GERD usually affects individuals over the age of 40, it can develop in people of any age, commonly affecting men and women. However, men are more likely to develop complications from it. So as a nation, we have a lot of GI issues that are becoming more and more prevalent. This is not surprising since we most often wake up and we're immediately surrounded by toxins and endocrine disruptors. And we ingest a lot of these toxins, even a simple example being in our toothpaste, in a lot of the foods that are ultra processed with preservatives, corn syrup, seed oils, sugar that causes inflammation, dyes, other synthetic substances in our foods. I mean, we also are a society that is quick to put ourselves and our kids on antibiotics, which disrupts the balance of that gut flora. We even get secondhand antibiotics from livestock if it's not 100% grass-fed and finished and hormone and antibiotic free. We eat grains on a weekly basis, like oats, for example, that are filled with saponins, which create a permeability in the gut lining, and they also chelate or bind onto other nutrients, preventing our body from absorbing them. So we also eat food covered in pesticides. I mean, the list goes on and on. We can talk about all of these harmful things disrupting our gut. And it might be a little overwhelming, or you might say, well, you know, there's so many things, why even try to like avoid these things? There's only so much you can do. How do you avoid it if it's in everything? And I'm here to tell you and encourage you that it is very, very possible to live a life consuming the smallest quantities possible of these toxins. And if your life is filled with these toxins already, it really just takes eliminating one thing at a time and implementing one good thing. So I want to encourage you with that. I will leave you there. But also I want to mention what Dr. J and I will be touching on in the next couple parts of this GI series are the main contributors, which I kind of went on a soapbox about, and the chiropractic care that can help. We'll also do a little Q&A where we will be answering really great questions from you guys in depth. So keep your eye out for those next parts. I want to thank you for listening to Chiro Thoughts GI Function Part 1. This is Dr. Adriell, and you